Hello, and welcome to the virtual presentation for CCHF 2023, the one-stop shop co-locating MAR services on Chicago's West Side. My name is Brienne Hirsch. I'm the Recovery Community Social Worker over at Lawndale Christian Health Center. I will be your disembodied voice for today's recording. At the in-person conference in March, I will be joined by Dr. Thomas Huggett, Dr. Benjamin Preyss, and Daniel Wiegman, also from Lawndale Christian Health Center. Our presentation at the conference will be a panel design. So today we are just going to share some of our background knowledge and some of just background information as well to kind of lead us into our panel discussion. Thank you for joining us, and we hope we can entertain you. So as I mentioned before, all four of us are staff here at Lawndale Christian Health Center. We are an FQHC located on Chicago's West Side in the North Lawndale community. Daniel Wiegman, who you can see here on your left side, is our Certified Recovery Support Specialist. His role here at Lawndale Christian as our Recovery Care Coordinator focuses on providing resource support to our patients with substance use disorder, as well as connecting those patients to higher levels of care, such as medical stabilization, 28-day residential programs, recovery homes, sober living, etc., etc., etc. Directly to his right, you will see Dr. Thomas Huggett. He is our Director of Mobile Health Services. So we have a mobile health team that is based in a variety of homeless shelters across the west side of the city, where we have providers and medical assistants come into the shelters in order to provide medical care, as well as MAT services. Up next, you will see Dr. Benjamin Preyss. He is currently our Director of Recovery Services, as well as our Family Medicine Residency Director. Dr. Preyss is also a board certified in addiction medicine and oversees our SUD, our Substance Use Disorder Specialty Clinic, located at our main campus. Last but not least is myself. My name is Brienne Hirsch. I am a licensed social worker. I operate in our substance use disorder specialty clinic as well, leading behavioral therapy groups, providing resource support, as well as brief interventions to our patients. So the goals for today's presentation is fourfold. We are here to share about our lessons that we have learned along the way from people in recovery through our patients, our co-collaborators, as well as just being located on the west side of the city. Stories and personal experiences can hold such power in our lives when it comes to creating and imagining a better future for our neighborhood and for our community. Another focus to today is talking about how to implement this holistic biopsychosocial spiritual care into both medical practice, agency practice, and talking about the benefits of being co-located even with finite spaces and resources. We have learned along the way that the more resources we can put into one location, the more benefits we can provide to our community, our neighborhood, and our patients. As well as we have incorporated more resources, we have incorporated more models of care, right? So we address the medical care side of it. We address the psycho part of it through our behavioral health services, our social part of it through our recovery community, as well as our social work and resource supports, and as well as being a Christian health center, we always and everything incorporate the spiritual side into all services of care. And our goal for today, I don't think we need to convince you that having more resources is a benefit, but we're here to share how even locating these spaces in the same building, within the same community, can be a benefit, and how we can do that even if we aren't a giant health clinic, right? Even if we are a smaller agency or organization, how we can go about that. Next, Another goal for us today is to provide encouragement to keep going, right? Oftentimes we find ourselves working in the thick of a system that does not work, right? We're working to fix a system that's often broken. And through years and years of practicing within and around that system, we can often find ourselves broken as well. And so our goal for us today is to connect with you, to build community, and keep you going alongside of us. We understand what you're working through and who you're working with, and just to encourage you to keep walking in the footsteps of where you have been called, and where the need is most greatest. Last but definitely not least, our goal for today, as is said in our mission statement here at Lawndale Christian Health Center, is to show and share the love of Jesus, right? That's what we need to do in every act, every step, every decision. But most importantly, we're doing that with unconditional positive regard, right? So that's taking an approach of always assuming the best in every human, every patient, every client, every colleague that you interact with, right? Focusing on that unconditional love, that unconditional, right, positive approach, as well as positive outcomes. And so with all these things in mind, overall, our goal for you today is just to share where we are, where we've been coming from, and just kind of, contribute to the increased knowledge across the country, across the Christian atmospheres, of just what we've learned, through our history of working with our neighborhood and in our communities, and how we can assist you in pointing you in directions of success as well. So why are we here? Why are we doing all these things? Why do we have a health center on the west side of Chicago? So Lawndale Christian Health Center was founded in the 80s. It originally started as Lawndale Community Church, founded by Pastor Wayne Gordon. It was built by the hands of the feet of young individuals in the North Lawndale community. And over the years, it has grown and grown to meet the needs of Chicago's West Side, developing into numerous clinic spaces across the West Side, where we offer everything from primary care, pharmacy services, OBGYN, MAT, pediatrics, right, senior services, recovery services, you name it, we pretty much got it. Alongside with our partners over at Mount Sinai Hospital and St. Anthony's Hospital, where we often send our patients when they need that specialty level of care. What all four of us here are today, what we focus on and where our passion lies, is addressing the opioid epidemic. And so this is a recent graphic. This is sent out quarterly by the Chicago Department of Public Health that talks about opioid-related overdose EMS responses. So this graphic is just from earlier this year on January 2023. And so if you can see that bright yellow spot right at the bottom, that is pretty much right there, right in the center of all of us. Where it says North Lawndale at the bottom, that's the closest to one of our clinics. But where those hot spots is, you see up north off of Pulaski and West Garfield Park. That's where we're often serving our patients experiencing homelessness across the shelters, and where we're often getting our patients from. So in just January 2023, there were 804 citywide opioid-related EMS responses, and 247, 31% of them, were located in the West Side neighborhoods, which is outlined by that dark gray bar around the map. So while this is a slight decrease from December, and it's just a slight increase from last year, we're kind of holding steady, knock on wood, from last year. So this kind of shows some of these hot spots along it. Oftentimes in the North Lawndale, you hear area, hear about the Pulaski corridor, which, as you can see, is highlighted by those bright yellow spots, which is just the heart and center of the opioid epidemic in Chicago. And so that's the need. That's why we are here, is because we are passionate about addressing and ending the opioid epidemic. And that's where we focus a lot of our attention and passion and resources to these areas. Now we can sit here all day and I would have so many graphs to show you, but I don't think I'm speaking to a population right now that needs to be convinced of the severity of the opioid epidemic. So what we're going to focus on today is, what are we doing about it? How can we go about making these changes? I want to see those hot spots gone, right? We want to decrease the number of overdoses, and we want to increase the number of supports and resources that we want to give to them, right? We want to flood the streets with love, warmth, care, and compassion instead of flooding the streets with substances. So to start, we just wanted to give a little timeline of how our recovery services have developed over the years here at Lawndale Christian Health Center. Now, this timeline could be much further back, but we're going to kind of focus on the recent past and how we have developed over the last 10 years and so. So, of course, the most important thing that we love to mention and pull up is in spring of 2013, Cook County, where Chicago is based, implements the Affordable Care Act, or Obamacare. This starts making a tremendous difference for our neighborhoods and communities as low-income individuals are able to get medical care. Prior to joining us over here at Lawndale Christian Health Center, Dr. Huggett was already working for another medical entity, the Circle. So he joined our team around the fall of 2016, and he starts prescribing Suboxone, right? Buprenorphine naloxone, a medication-assisted treatment indicated for those with opioid use disorder. It works to reduce cravings and urges and provides time for the brain to heal from the throes of chronic disease of addiction. As well as in fall of 2016, our clinic and one of our behavioral health providers, Brittany Buckner, starts our first recovery groups located at one of our clinics on the west side. She would lead a transformation group each week, and patients from the community would be able to join and receive cognitive behavioral therapy groups. While both accessing the behavioral health side of it, they were also to build community with other participants in these groups. As the clinic started getting more and more providers to prescribe Suboxone, we started getting more and more waivers. Praise God, the waivers are gone. We noticed that we needed to make sure our behavioral health and our recovery services were staying on par with where our medical services were. So starting in the summer of 2019, our recovery community was created. This is a modified intensive outpatient program. It's an office-based outpatient therapy. And this was created as we had gotten some interns from University of Illinois at Chicago's social work school. So our recovery community consists of behavioral therapy groups in the morning, led by either a behavioral health provider or a social worker. It's followed by a wellness activity, or something we like to call recovery capital, where patients can engage in new crafts, hobbies, educational experiences, outings, retreats into the community as a chance to kind of fill up that free time that is often dangerous once people enter in recovery. These interns from the social work school were also providing resource support, so in terms of accessing vital documents, housing, employment. And this was happening 3 days a week in a new location off of our main campus. In 2020, I don't think it needs to be said, we all know what happened, but due to infection protocols, just the spread of the coronavirus in the city, our recovery community program had to shut down from March to September, as well as most of our MAT services when it comes to medical appointments were converted to telehealth. No need to fear though, we tried to bounce back as quickly as we could. The following summer, once things had stabilized and our vaccines were on the way, recovery community was able to reopen again, as well as transition into being available 5 days a week. So Monday through Friday, we would have groups every day starting at 9 a.m., followed by that wellness activity at 10 a.m. And then through the rest of the day until 5 when the clinic closed, we would have resource support available for patients to stop in, and just get connected to the things that they need. At the end of summer 2021, we started integrating these substance use disorder specialty shifts into our clinic schedules. So there would be one provider a day that would see patients solely with substance use disorders for their entire schedule for the day. We saw the need for that grow and grow. It gave opportunity for the providers to have dedicated time in the clinic visit to address substance use disorder, and it allowed patients to follow up with a provider regularly, because oftentimes when patients are in recovery, weekly or bi-weekly appointments are often needed until some stability is garnered. At this time, our recovery community was already utilizing a space just across the street from our main clinic building. It was the entire first floor of one of our buildings where we were able to have a group space for our patients to meet and for them to participate in the activities. We had a room off to the side where our behavioral health providers would utilize for individual consults. After much discussion, much praying, much brainstorming, we decided it would be best for our patients, for our community, to have providers in the same space as our recovery community. So we built an exam room right in the room next door to our recovery community and started having one provider there every single day of the week. So patients would be able to come in, attend their office visit appointments, engage with our groups, engage with our social workers. And so in the fall of 2021, we co-located, and it's been so exciting ever since. In spring of 2022, MAR now launches in the city of Chicago. And so this is a hotline, essentially, that residents of the city can call, and it can connect to them to MAR, a medication-assisted recovery treatments, the same day, either speaking with a provider over the phone, or getting connected to an in-person appointment within the next 24 hours. And this definitely changes the game because it, again, just gets at increasing the access. In summer of 2022, we hired Dan, who is a recovery care coordinator, as I mentioned. He is also a certified recovery support specialist, and most importantly, he is a professional peer support as a person with lived experience. And this just continued to check off our goals of incorporating more specialized services for our patients, as well as highlighting the importance, the extreme importance of having professional peer support for our patients. And most recently, in fall of 2022, as our SUD clinic grew more popular and had overwhelming support across the clinic as a way for patients to kind of just engage in a more in-depth holistic treatment experience, we increased our services to having 2 providers per day every single day of the week, Monday through Friday, for patients to come and see both further MAR services, but as well as full primary care services as well. We also excitingly started offering an in-house psychiatry shift once a week with Dr. Crystal, one of our psychiatrists, where patients could have a day of consult with a psychiatrist. Our providers could ask consulting questions for their medications as well. So that is where we are at currently. So holistically overall, right, we're offering our recovery community with behavioral therapy groups, wellness activities, resource support. Our patients are being able to be seen by a medical provider, both for MAT as well as full primary care services. We have peer support services as well as psychiatry services. So the question I bet you're all wondering is, how did we do it, right? How were we able to get to this point where we can offer this wide range of services, and what have we noticed to work best for us? Obviously, this is what we would like to impart on all of you, but as individual providers, agencies, and organizations, these will need to be adapted, right, for the specific needs of your community. But I think it's just important for us to highlight, nothing came without trial and nothing came without error as well. So the first main thing we noticed that best suited our patients was being as low barrier, low threshold as possible. And this came in terms of accessibility and capacity. In terms of accessibility, right, being open Monday through Friday from 9 to 5, as well as being at our Ogden Avenue location, as well as being located in various mobile health sites in homeless shelters across the city. This also looks like as we offer same-day appointments for any patient that walks into our SUD specialty clinic. So any patient can walk in from 9 to 5 and start treatment that same day if indicated, whether that's new patients, patients looking to reestablish care, referred from our hospital systems or other community partners. Our motto is nobody will leave out the door without a prescription if they want one. So that's something that we really pride in. We often see ourselves sometimes hitting, 10, 12 walk-ins a day on top of regularly scheduled patients. And so whether that's finding an office visit for them in our SUD clinic, reaching out to the clinics next door, those people do get taken care of that same day. And so that kind of leads into our lessons learned about our capacity as well. And we learned that, right, when we first started those substance use disorder specialty shifts, that one provider, one day was not enough, right? And so that's where we pushed to co-locating, making our own SUD specialty clinic, increasing the number of providers in that specialty clinic, but as well as making a push for all of our providers across our different clinic sites to also offer MAR services. The next lesson that we learned is our emphasis on positive connections and community, right? It's one thing to be able to provide people a service, provide them a medication, provide them a referral to a specialty provider. It's a whole nother thing to do that with warmth and intention and positivity, right? And so when our patients come to us, with our low barrier harm reduction model that we all practice on, right, we often reinforce with patients, like, even in the throes, even if you just use this morning, just come see us, right? We want to see you, we want to love on you, we want to care with you. As well as putting that into the community, creating a recovery community, a safe, warm, inviting space for patients to come engage in their recovery goals. Next, obviously, integrating professional peer support. It's one thing to go to school and learn all these things. It's a whole nother thing to live it yourself. So by incorporating peer support, hiring professional peer support, certified specialists, we can see the impact easily in what they make in connecting with patients on a whole nother level. Next, focusing on outpatient withdrawal management. Oftentimes, the medical stabilization, or as you've often heard, detox, doesn't work for some people. So we've tried to make it a focus on how to do that from outside of the hospital system, whether that's through microdosing, having tailored blister packs made for patients to start their buprenorphine, and using the other resources that we provide in order to get through that withdrawal period. Also, our collaboration with community partners, right? Partnering with other hospitals, recovery homes. There's a Westside heroin task force the city that we partner with, and just making it known who has what, where to go, who to go to for what needs. And the more that we can collaborate, co-locate connection, the more it has been serving our patients. Next is creating a safety beacon for the community, right? Letting people know that we're here and we're ready and willing to support them, right? We oftentimes will just let our patients be in the clinic space, right? You know, maybe they used and they need to kind of sleep it through or get through it, right? And just having our patients know and having our community know that this is a safe space for them to get support. Last but not least is also providing all those other resource supports. Oftentimes we find ourselves, you know, getting at their motivation by maybe starting not with the medical things, maybe starting by getting them an ID and a birth certificate increases our trust. It helps build rapport where we can then work on engaging them in recovery or primary care services. And that kind of just gets back to the whole holistic side of everything. And so as I said, this is often this will be presented as a panel over at CCHF this year in 2023. But we would invite you, if you have any questions, to reach out to us. You can find us in our presenter profiles on the conference webpage or HOVA. We're more happy and excited to engage with you, answer questions, swap stories, and just chat about how we can, you know, show and share the love of Jesus through the work that we do. Thank you so much for taking this time to listen and engage. We hope that this information has been beneficial to you in your communities and neighborhoods. And as always, just want to encourage you in the work and the service that you are providing for your communities. Thank you.